do. And if you look at the other side, they want to create more government, a national health care thing. Can you imagine? I mean, I can't imagine any intelligent person in the world looking at how government screws up everything, how they can even think of it. It's astounding to me. Anyway, Ian, on healthcare.
Yeah, and that's why we're not thinking of it. This is one of those misleading arguments that's made by the other side, that Barack Obama wants to create a nationalized or socialized healthcare system like they have in Europe. No, he doesn't. No, he doesn't at all. Here's what he wants to do. He wants to create affordable, accessible healthcare for all Americans, and here's what it would be. You would have if you like the healthcare that you currently have, well, you keep it. If you don't like the healthcare that you currently have, or you can't afford to get health care, we would create a series of options for you, but here are two of them. One, you can buy into the plan that the United States senators and congressmen have, because if it's good enough for them, it should be good enough for you. But the other option is we're going to create a national health insurance exchange of not public companies, not government-run, private companies, private insurers, Aetna, Blue Cross Blue Shield, the same private companies that exist today, but we've set some rules of the road, for example, so they can't deny coverage for pre-existing conditions or unilaterally change rules on you or raise premiums outlandishly so that people can't afford them. And if you still can't afford that system, we'll have a sliding scale subsidy that goes in to cover low-income people if they don't qualify for Medicaid or S-CHIP. We provide a subsidy so that they can purchase coverage, because when everybody is insured, we don't have people going to the emergency room where it costs multiple times what it would cost if you actually had primary care, coordinated care before it became an emergency, because in this country we don't have a health care system, we have a disease care system. So that's the first thing we would do. The second thing we would do in order to be able to afford this is you need to bring down spiraling health care costs. We need to modernize our system. We're on a 19th century paper healthcare record system. If you have a procedure done as a child in Utah, and then you move to Alabama, and you go to a doctor in your 20s, and they don't know what procedure was done in Utah because the paper's lost somewhere, they might perform it again. That happens time and time again. It costs us billions of dollars a year. If we digitize that system, we save that money. And here's the third piece. We need to invest in prevention and public health. We need to be addressing childhood obesity so that we don't have to address adulthood diabetes, which is far more expensive to treat. And if we put these common sense principles into place, we will have a private market-based, affordable, accessible healthcare system for all Americans that will, on average, lower costs for the average American family by $2,500 per year. Now, what is John McCain proposing? His proposal is to, for the first time ever, impose income taxes on the healthcare benefits that your employer provides. Now, I agree with what Wayne has been saying all day, which is we need lower taxes. So if that's the case, why does John McCain want to impose higher taxes on healthcare benefits, which would raise taxes on the middle class and discourage employers from providing healthcare? And there's a last thing that I want to point out, because a lot of you will fall into this category. If you're under 25, under Barack Obama's plan, you'd be able to stay on your parents' health insurance. So that when you first graduate college and you're looking for your first entry-level job, and they may not be offering the best benefits, or you're going through a transition phase figuring out what you want to do, you can be covered under your parents' plan.
Yeah.